Hello, warriors. Hello, healers. Welcome back to this video. If you're viewing this on YouTube, welcome to our YouTube platform. If you are seeing this and practice better, thank you so much for watching this video. If you are listening to this in our podcast, thank you. And I really appreciate you taking the time to be here, to listen, to watch, because I think this video is going to answer so many of your questions. We're going to talk about our process, money, and your return on investment. Okay? As you all know, with us changing the structure of our practice, we are introducing confunctional, which is conventional medicine, with functional medicine, where you can actually get the care like you would, receive in a conventional space, with us identifying, investigating to help you identify or the root cause of whatever's going on with you, right? If you are new to my platforms, my name is Dr. Jennifer Genzia, which I don't think you guys are new because I'm sending this out to my current patients. But if you're new, you're like, oh, what is this lady? I am a functional medicine practitioner. I've been practicing for the past 10 years. I love it. I was designed to do this. I am in my willpower when I am helping my patients implement simple things that will get them results. I specialize in gut health, hormone imbalance, and weight loss. Those three things. However, when we are working with our patients, we're looking at the body as one vehicle, one vessel, because I think every single part is connected. If one is not working, that might trickle down to the other parts, and you might feel symptoms from different organs and parts of your body. So therefore, we look at the individual as one. We do not address the gut we do not only address the gut if you have headaches, right? We do not only address the gut if you have like hormonal imbalance. We address your whole body, but we do understand and believe that your gut is the portal for illness, and also is the portal for disease, is the portal for health. Wealth is the portal for health, is the portal for healing. So therefore, we always, 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 always look at the gut as a way for us to start healing the body, because that's where your immune system is. That's why you have no transmitters are produced in the gut. That's why you can balance, there's some conversion taking place, and that's why your toxicity channel is in your gut, okay? But today I'm going to talk to you because we have been receiving quite a few questions in terms of the financials, your return on investment, our process, and how this new change will affect you in the long term or will affect you positively, okay? So again, if you didn't catch a few of our previous videos, I just hired a practitioner that is very, very, very good in delivering conventional care. Her name is Deborah. She is a family nurse practitioner. And to be honest with you, I've been looking for someone like her for a long, 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 long time. I've had multiple interviews, and finally I found her. She is sweet. She is lovely. If you met her before, you'll probably agree with me, but she is really passionate about helping you not only receive the care that you deserve, but also involve in your own health journey, just like I do. Okay. So she's going to help me see many of you guys, because I did a whole spiel about how it's going to get worse. People are getting sick and blah, blah, blah. I'm not going to go to that, but it is very important that you dedicate, that you prioritize, that you do all the things that you need to do to heal your body, to decrease your symptoms, to eliminate your symptoms, to get rid of diseases this year, 2024. So with confunctional, again, we're going to go through the process of giving you all the things you could receive from your primary care doctor in the conventional space and tie it back into functional, because it doesn't make sense for us to say that we're going to help you if we don't know the root cause. So that is why I came up with the term. It's my own discovery, my own creation. There's no such thing as confunctional, but I came up with it after I've, discussed with many patients. We received so many calls, people wanting us to also provide primary care services. So now in 2024, it's happening. Okay, so in the light of us promoting confunctional medicine, the office visit used to be 4:30, which I mentioned in the last video. If you haven't watched the YouTube video or listened to the podcast, you can go back and do so. But then I decreased it to from 4:30, which is 2 office visit, to 1 office visit to 10 until March 1st. As of March 1st, which is next week, at the time I'm recording this, the prices will go back to $250. Okay? Prices will increase to $250. Why? Because it is not sustainable to really run a business, a practice, doing all the things that we do for the compensation and the fee that we are charging. Okay? Now let me tell you what we do. Our process have not changed. So when you find us and you decide to schedule an appointment, what we do, we give you an extensive intake form. You need to complete the intake form before you come into our office. If it's not completed, we schedule your appointment. Okay? Because at the end of the day, myself and Deborah and Marilyn, we are serious about helping you heal your body, about helping you regain your energy, balance your hormones, lose weight, feel your best, have a flatter tummy, better skin, like all the things that you desire. We are invested in your journey. We are serious. You will take time to complete the intake form. Yes, it is 9 pages, but guess what? The more information you give us, the more we can help you. Because the number one thing we don't want to do is you come into our office and then we are flipping 2 pages because you just completed the intake form. We don't know what's wrong with you. We don't even know why you're here. And we are depending on the information that you put on that paper at the time of your appointment. And then we are missing so many things. Okay. So when you schedule your appointment, we register into our HIPAA compliant Practice Better. And then you create your own patient profile. And then Marilyn will send over 3 forms, the intake form, a consent, and also 7-day food journal. And you need to complete these 3 forms before you come, like 72 hours. I would love it to be 72 hours, but at least 48 hours before your appointment. Why? Because again, we do prep work. We prepare before you come. And we also ask you to send over all your lab results. Why? Again, we don't want to repeat what you have done in the past. Not only does nothing for you, does nothing for us, doesn't help us help you, but when it comes to insurance, we also have to make sure that we are not getting the insurance people upset because this doctor keeps prescribing the same CBC, the same basic blood work. Since we know many doctors do prescribe basic blood work, we ask you to send the results. So before you come in, I'm looking at your intake form. Deborah's looking at your intake form. We're looking at your lab results prior to coming in. So it will take 1 hour to prep. As we are going through your paperwork, your documentations, we are formulating our own questions. We are connecting with you in a way, we are understanding your story. We are studying what is going on with you so that when you come in, we can ask you the proper questions. You'll be amazed how many things come up as we are talking to people. They'll be like, oh, wow, you're right, Dr. Genty. I remember this, I remember that. But at the time of them completing the intake form, these things probably escape the minds. But as we are talking, we are investigating, we're asking the right questions, right? That cannot bring up certain things that they forgot to share on the intake form. So it is very important for you to complete your intake form, to send over lab results and complete the 7-day food journals. Because if you do that, I can give you some recommendations as of dietary recommendations of things you should be eating, things you should eliminate. If you put your supplements on the intake form, I can research them before you come in, okay? So that I can look at, which supplement has the gums, the binders, the fillers, the preservatives, like all of the things. The more information you provide on the intake form, the better it is for you, the better it is for me, the more, time we're going to have to focus on you, to fast track to, from where you used to be to where you are now, to really focus on what is the most important thing is to listen to your story, look at, listen to your concerns, and give you some basic recommendations or things that you can do right away to help you start feeling better, or to help you decrease the toxicity level, to help you, kind of navigate and start this journey while we wait for other blood tests. Okay, so that's an hour. That's an hour. We've spent an hour. And then you come in, we spend anywhere from 45 minutes to an hour. Because again, we're already working on your case before you come in to our clinic. We're not working on your case when you come here. We are working on your case before you come in to our clinic. So therefore, that work started before you come in. That's pre-work. Okay, so we can spend 30 minutes with you. If we got everything on the intake form, it is better. And then you can just go about your business and we can just send you, discuss all the things. If you do a great job completing the intake form, then I can take the other time to go over results, show you some possibilities, give you some hope, like I did, a few days ago with the patient that had a UTI. She didn't know I could help her, so I just pulled on my screen, of course, with, consent of previous patients that give us reviews, that send us notes, all the things, UTI or yeast infection or eye issues, like whatever the symptoms are, diabetes and high blood pressure, hormone balance. So I just say, look, this is it, this is it, this is it, right? So we can spend 45 minutes talking to you, making sure we're getting all the information, evaluating, assessing your health. And then we take time to check your blood pressure, listen to your heart, look into your mouth, we do focused examination. If you come into me and you clear in your throat and there's postnasal drip, or you tell me you used to have canker sores in your mouth, inside of your mouth, I'm going to have you open your mouth. I'm going to have to look to see if I see any scars from the canker sores or spots from the canker sores. If you come into me and you tell me about lung issues, I'm going to listen to your lungs, right? If you come into me have skin issues, I'm going to have to show me what the spot is. So we do focused physical exam, but we take people's blood pressure on every single visit, okay? So it is a very detailed appointment, which I know many of you guys are not receiving currently from, other practitioners. Some practitioners are doing a great job out there. I mean, I know a doctor that does exactly what I do, right? But in the conventional space. Still give you a prescription, but in the conventional space, 30 minutes. He spends 30 minutes with the patient and do all the things that I do, 30 minutes. And try his best, because he still has to do, he still has to see 20 other patients that day. That's what we get. And then you go off. After you leave our space, our clinic, we work on writing up what's going on, because you never know when insurance is going to ask for us to submit documentations if we, submit it on your behalf like we do now, right? And then when you do go ahead and do the paperwork, the results come in, we have to look at that too. Okay, and I'm saying this because many of you are not understanding the work that we do. We do work before, now, and then after. We have to look at your results. We have to look at the results, because I have to look if there are alarming emergency like markers, if I need to call you right away, have you do something right away. Like I had a patient had a very, very, very low iron, very low iron. So I had to call that patient. I'm like, this is critically low. Low iron, low hemoglobin, low ferritin, low B12, low all the things. And then you can tell that patient is symptomatic. She was symptomatic because she had shortness of breath, chest pain, fatigue up to the was like a lot going on. So I had to ask her to, because she has insurance, to go to consult with the hematologist, or find a hematologist. We consult with the hematologist and have her do some iron transfusion, right, while we wait for the other results. Okay, so every time you do a blood test, I'm looking at the results. Why? Because I don't want to miss anything. I don't want to miss anything. I want to make sure that I'm catching the things that are critical, and it's also my license. I am very transparent with you guys. If you know me, I am very transparent, because I don't want to miss something and then something happens and then you end up in the hospital. I'm like, okay, this doctor practiced negligence. I am literally all about your safety and the healing journey that you're on, And knowing that you trust us, right? You come into our space, I'm looking at all the things. If I don't reach out to you, which I don't usually do because I already know these things were there already, these things did not just came up on the page, a lab results, like the day you did the lab or the week before, they were there already. So it's not an emergency. I know many of you guys are looking at your results. You're like, oh my God, I have Coxsackie. What is that? Call Dr. Jens, it's an emergency. It's not. Specifically, if the IgG is elevated, the antibodies are elevated, it's not. So I am looking at the test and I'm preparing for your follow-up. Okay. The follow-up as of the moment now at this time is $150. $150. Again, we spend 30 minutes to 45 minutes, depending on the test result. It's not about the time, it's about the quality of the visit. Sometimes patients come to me and it's like they pay for an hour and I'm like, an hour and a half, we're still going through cases, right? Because sometimes I have so many questions because I want to be able to identify if I can help you. So looking at the blood test after you do it, I'm looking at the markers, I'm looking at the results. I am formulating a customized plan for you. And now, because we know that many of you guys are requesting different levels of our programs, we have 3 tiers. We have the full package, full exclusive, receive all the things. And then we have tier 2, tier 3, depending on the level of assistance you need, how much help that you need, because some people can just take the herbs that we use, recommendations, and just run with it. They don't need a lot of guidance, a lot of support. So you get to choose. So I give you 3 tiers, right? That's what we're doing now. And there will always be IV vitamin therapy recommendations because at the end of the day, you coupling IVs with whatever I'm recommending is only gonna enhance the healing process, even if you were to do IVs only, because when it comes to IV, you are infusing and replenishing all the nutrients that your cells are missing for them to do the work, because so many of us are so depleted. So many of us are so deficient, we're not even aware of it, right? And so many of us are looking at the food we're eating to replenish. But unfortunately, that doesn't happen because when we eat food, we have to think about different factors in place. We have to think about malabsorption. We have to think about toxicity level. We have to think about the food being, packed with herbicides, pesticides, sprayed on, glyphosate. There's so many things you have to think about while you're not really getting the nutrients that you need from the food. Even organic food sometimes, right, can have a level of contaminants. So IV vitamin therapy is very important. And with IV vitamin therapy, you can see results quicker and faster. So we're doing work before you come, when you come, after, in preparation for your follow-up visit. Okay? Because when you come, for your follow-up visit to maximize time, I don't want to be looking at results and be like, oh, this is, and then when you ask question, what is this? And I don't have an answer for you. So I study your case from the minute you schedule an appointment to the minute you schedule your follow-up, okay? And then with the follow-up, I go over the results with you, every single category, whether they are normal or not, every single category. This is, this is normal. This is what I look for when I prescribe it. So I go, because not only I want you to be educated, right? So if you were to go to your doctor and if you were to do a CBC, and you don't know what a CBC is, what a CMP is, like you don't have those basic knowledge, things can be off and you won't know. Because many of conventional doctors are waiting for things to be significantly high, significantly low, or like critically abnormal for them to say, hey, this is what you need to do. Or if it's on the low end or the higher reference range, they're gonna wait until things are like literally not working for you to do something. For me, it's not like that. I'm always looking at what to maximize and optimize, right? For us, is what we look at, because preventative care is the best care in the world. If you can prevent something, not only is it gonna cost you less money, it is also gonna help you perform better, and you can optimize your health. It's a win-win situation. So I look at every single markers, lab values, and I take that time, the opportunity to educate you so you can know what these things are and why doctors are prescribing them, what they are looking for. Very important. Okay? So the $210 before March 1st, price is going up March 1st to $250. It's an hour before you come, 45 minutes, when you come to an hour, depending. And then we take 30 minutes or an hour after to look at the results, to formulate your protocols, to study your case, to do research. Okay. And then when you come for the follow-up, which is $150, we go over your results, and then we'll go over the recommendations, the customized plans that we create for you. We send an Excel page, and then you get to choose what you want to do. Because I know many are asking, okay, well, since you don't take insurance and I have to do this, what am I getting for the 210? And to me, it's like, it's the mindset we have to work on the mindset. I'm trying to find a nice way to say this, because I know many of you guys will be triggered, right? It's $210. Even if I did no work before, no work after, and I just meet you 200 for 30 minutes, you still get a lot of value. Okay, you still get a lot of value for that price, for that money. But again, it's up to you. I'm not here to tell you what to do. Like, you prioritize whatever you prioritize. If it resonates with you and you agree with me, fine. If not, then that's okay, no problem. But I wanted to go over our process, what we do, and how we are helping our patients not only identify the root cause, how they can have, make them see all the options and the possibilities for them to heal the bodies, and what I think a process should be for any doctors, right? Even if you're not seeing me, if you go see your other doctor, you should really ask them, are you looking at my intake form? Because I realize that many doctors now, offices, medical office, is sending you intake form before before you come for your visit. Like, many of them are doing that. They are sending you the intake form. They're asking you to complete the intake form before you go there, which is, to me, is a beautiful thing. It's like, oh, great. So the doctor knows what I'm, faced with, what I'm dealing with. They know what my symptoms are. So I can just go in, talk to them, discuss the issues that I'm having, see if they can help me and how they can help me, what the next step will be. And they're not wasting my time. I'm not wasting the time, and we all can be on the same page. I think it's a beautiful thing. Okay. And then the follow-up visit, we should always, always sit down with the doctor and go over all the results of the blood tests. To me, I think it's very dangerous for you to do blood tests and never heard back from the doctor. I think that's very dangerous. For you, maybe it's no big deal, even if everything is fine, but this is an opportunity for you to learn, for you to really know what's going on internally, for you to see what you can be doing better, for you to see where you can optimize and change, and like, really, like, what do I need to do to feel my very best? What do I need to do for, to prevent another cold, another flu, another COVID, another sinus infection, another gut issue? What do I need to do? I mean, I'm doing great, but what do I need to do to really balance my hormones, to get my moods back, right? For my brain to function like it used to, at least increase the cognitive function, for me to prevent Alzheimer's and dementia. So there's always room for improvement. There's no one has perfect health. There's no such thing as perfect health. So that's what I wanted to go over with you. We discussed the price. It's $210 before March 1st. As of March 1st, price is going up. It's going to be $250. So if you watching this, you listen to this, you're like, oh, wow, I need to get into this functional thing. You can call and schedule an appointment, even if you're going to schedule an appointment after March. I mean, as of now, this is the last week of February. We are completely booked. People heard that we're going to help them identify the root cause. It's 210. People are calling. And I'm like, yes, that's exactly what I want. And with all of you, or if you know anyone that never benefit functional care, to have access to that, to experience what it is, to receive the care, not only a 15 minutes visit, here's a prescription, to really come in and say, hey, let me sit down with this doctor. Let me just discuss all the things that I need to discuss and have my concerns heard, right? Like, I can lay it on the table, right? And be seen and be heard, and not be rushed through this process. Not be like, okay, well, it's 50 minutes. I got to go see the next patient, right? Like, not be handed a script. Because there's so much you have to say. There's so much that's within you. You just want to let it out. I know you do. And with functional medicine, with conventional medicine, with functional medicine, it's the time for you to do that. right? Even if you don't have anything going on, maybe it's an opportunity to ask the practitioner the right questions. Like, I'm feeling good, but I'm scheduling this appointment to see what I can do to maximize, to perform better, what I can do, where do I need to look, right? So Deborah, the nurse practitioner, I'm sorry, this is real life. I'm recording this and I'm looking at the window. This guy is walking around, like making circles in the middle of the road. Oh my God, this is so dangerous. All right, let me get back to what I'm doing. Things are happening here. Deborah, she is the nurse practitioner. She's a family nurse practitioner. So we're gonna start seeing kids as well. And that's another announcement I'm gonna make. She is awesome. And another thing too, I wanna put to rest is that yes, you're not seeing me. I understand many of you guys will not see me, you'll see her, but guess what? I'm also looking at everything she's doing. We have 4 pair of eyes. I have 2 and she has 2. 4 pair of eyes looking at everything she's doing. Okay. And sometimes things might be better. Like you never know. So if you're a new patient or you're a returning patient who's looking for a practitioner and you want to schedule an appointment and you're going to see Deborah, I don't want you guys to discount her, right? Because she's been practicing and I've literally taken time to look at all the applicants. That's why it took me almost 3 months to find someone. 3 months in this economy in recession, like there's no job out there, right? We got tons of response and replies from Indeed and ZipRecruiter, and I also work with an agency that has helps hired practitioners, and it took me time because I want to make sure that every single human being that comes to my clinic is being taken care of the way I would take care of you. So yes, you might not be seeing me, you might be seeing Deborah, but she is coming to me with all the questions. I'm looking at all the cases. I'm looking at everything. I'm just gonna be like, my eyes are not closed, like, oh yeah, she get to do whatever she wants. And she's bringing tons of recommendations on the table too, right? Because sometimes my way is not the only way to get your result to help you. I'm not the smartest person on earth. I'm not. I'm not. I am not. I mean, I admit it. I'm not. So she is bringing her own expertise to the table, right? And we are working together, which I think is a beautiful thing. When was the last time you had 2 doctors on your case? 2 practitioners on your case. When was the last time you had 2 practitioners in your case? Looking when one, like, we can't miss anything, right? So rest and assure that you are receiving the best care. All right? I'm gonna close it here and I am gonna do another video. I'm gonna do a poll because we are doing in March, we're gonna be promoting an IV vitamin therapy infusion to celebrate Deborah being part of our family. And I'm gonna do a poll because I only wanna do the IVs for those that are interested. Okay, I only wanna do the IVs for those that are looking for specific IVs. So I'm gonna really leave it out to the public and do a poll so that I know which of the IVs speak to you, right? So schedule your appointment before March 1st to really get the discount of the 210. Because once you pay 210, all the follow-up visit will only be 150, right? And our follow-up visit used to be 230. We reduce that to 150. So at the end of the day, if money is financial is a worry of yours, you are saving money, okay? Because once you're not a new patient or haven't seen you for ages, you're gonna pay the 150. It's gonna be 150 until we, decide to raise it, to increase the price. All right, so I wanted to really go over that with you because I know many of you guys have questions as of what are you getting? What am I getting for the 210? Since my insurance, and billing my insurance, but we are submitting on your behalf. We are doing insurance verification on your behalf. I am paying a company to do that. And it's not cheap. It's not, because we get so many requests and I'm paying for each one. Okay, so at the end of the day, I am doing my part the way I can, right, to help contribute to the financial piece of your healing journey. But I just want you to understand, like, whenever you exchange, right, with us, whatever exchange you do with us, you are getting way more than what you paying for. Always, 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 always. And I am dedicated and invested in your care. It is to welcome to Dr. Jensen's world. It is two practitioners looking at your case. And I want you guys to really meet Deborah. She's very sweet, very patient. That's what attracted me to her. Because I don't want her to just come in and just do the conventional thing that, she was asked to do when she used to work. And that's the reason why she left conventional medicine to come over, because she was not happy. Just like me. I have so much, like her and her stories resonate so much, right? Liked attract like. So just like me, not happy, not making a difference. Even if I wanted to spend more time with the patients, I couldn't. It's the same thing with her. When I spoke to her, I'm like, okay, why? Why do you want to come over? And she told me exactly what I'm telling you now. And I'm like, okay, that's it. That's it right here. And then I'm training her on the functional medicine. We're looking at all cases together. We are analyzing, studying, like we are masterminding on your case. You are never alone on this journey. I guarantee you that. Okay? And this is just the beginning. There's so much happening. And I can't wait to share with you. I cannot wait to share with you all the things that are happening right now. And all the things, and then everything that we do, I'm always thinking about you guys. Always. And do I have to? I want to. I don't have to. I can be just like the other doctors. Like it's a transaction. They give you money, we'll give you a prescription. Next, money, give you a prescription. Next. For me, it's not like that. I'm holding on to the dreams of you healing your body, of you eliminating your symptoms, of you healing your body. I'm holding on to the dreams and desires that you have in your heart. And sometimes you guys are holding on with me, and many times you guys just let go, right? And if you're letting go, there's nothing I can do. If you're not being patient, there's nothing I can do. I know you can heal your body. And I know sometimes you have to do things that are uncomfortable to get you where you need to be. But holding on to the dreams, holding on to your desires, and really be present and really speak your mind and I am communicating with patients and practice better for free. Like people send me messages and I just answer. Why? Because again, I'm holding on to the dream. You don't have to be that much, you don't have to be sick. You can heal your body. All right. So I know it's a long, unedited video. I want to thank you so much for listening to the podcast and watching this YouTube video. Let's listen. March 1st, last day to call to schedule your appointment. After that, you will be paying $250. You can grandfather in March 1st and, be in before so that you can just pay the 150 follow up 150. Or you can just wait after March 1st and pay 250 and then pay one. Just kidding. It's really your choice. But I want to thank you so much for hanging in there. I want to thank you so much for all your support. I want to thank you so much for your understanding, for sharing, for subscribing, for liking, for commenting. And I just want to thank you for being you and for inviting us on this journey. I have so much gratitude, so much gratitude for you all, for the time that we live in, for having this opportunity to help. So much gratitude. Stars on my face. Okay. And I want you to know that whatever you have in your heart, the desires that the higher power, the universe, the God, whoever you believe in, put in your heart can become a reality. You just have to keep pushing. You just have to keep searching, and you should never give up. Even when things are not working for you, don't give up, because it's in your heart to get rid of this medication. It's in your heart to get rid of these diseases. It's in your heart to really feel your best and be present for yourself, for your family. It's in your heart to have the energy, the vitality. It's in your heart. It was placed there for a reason, because it is possible. All right. So if you know anyone that can benefit from this message, from watching this video or listening to this podcast, please, please, please share with them, please. As I said, caring is sharing. We're on this journey together, and I want to make sure that you know your options, you know there are opportunities out there for you, and you also know that we care. Okay, we at Wellness Corner and Jay, myself, Deborah, and Marilyn, we care so much. All right. Thank you. And you have a beautiful rest of your day, evening, morning, afternoon, whatever time you're listening to this or watching this. And I'll see you on the next video.